Namaste. Good morning and welcome to Times Health Plus. I am Dr. Sneha Rathi. I am a musculoskeletal physiotherapist and a certified yoga teacher from the Yoga Institute, Santa Cruz, Mumbai. I combine the techniques of yoga and physiotherapy and give the best results to my patients through them. Today, we are going to talk about one of the most important joints of our body and how to take care of it. The joint that is responsible for so many activities of our daily living. If you are walking normally, that joint is particularly required. If you are stair climbing, that joint is required. If you are sitting on the ground and getting up from the ground, that particular joint is very, very important. I'm talking about none other than our hip joints. So today we are going to talk about the joint that is so important in our body, that is the hip joint, and how to take care of it. We are going to divide tackling the hip joint into four parts. The first one is about mobility of the hip joint, stability or strength of the hip joint, the alignment, and the awareness. These four aspects are very important whenever you are doing any yoga asana related to the hip joint. So we are going to discuss about these four aspects of the hip joint. Before going to that, let's understand how is hip affected in different conditions. For example, arthritis. Uh, Not very common in the hip joint, but yes, it can occur. And what are the factors that cause this? Sometimes what happens is the hip undergoes some imbalance in the muscle strength and length, and that causes a lot of wear and tear over a period of time of the hip joint. So if you are regularly lifting weights, okay, if you are regularly doing activities that involve a lot of squatting, okay, you need a good proper length and balance of the muscles around the hip joint so that they don't undergo wear and tear. Okay, so that is very, very important. The second thing that is most common that can lead to hip joint arthritis is nothing but inflammation. So certain conditions like rheumatoid arthritis can be a triggering factor for arthritis of the hip. The third thing is sometimes the blood supply to the head of the femur or the hip joint gets obliterated due to many factors. Okay, there are many risk factors for it that leads to AVN, something called as AVN of the hip. That is also one of the very common conditions that is present. Okay, so that also needs, we need to take care that condition is diagnosed early and treated early as much as possible. Another factor that can cause hip joint arthritis is obesity. So increased weight gain. Okay, so weight gain, you have to have proportional muscle strength in order to tackle that weight. So it's very, very important that you strengthen your legs as much as possible if you have gained weight and work towards weight management in the long run. So that is another factor. There are some congenital factors that are present since birth, like hip dysplasia. So the structure of the hip since birth is altered. That can lead to hip joint arthritis. And another condition is post-traumatic. So after certain kind of injury or trauma to the hip, okay, sometimes fractures, that can alter the angulation at the hip, and that can also lead to hip joint arthritis. So these are certain factors that can lead to hip joint arthritis. But today we're going to talk about how you can handle your hip better. So I'm going to cover some aspects of how to take care of your hip in different senses. Okay. So first and foremost, let's start with talking about the alignment of the hip. Okay. So I'm going to show you the alignment of the pelvis, how we are going to understand whether it is in the correct alignment or no. Because if it is in the wrong alignment and you start doing asanas from the wrong alignment, okay, that can lead to certain kind of aches and pains around it, because the hip joint also influences the lumbar spine. It also influences the knee joint. So one joint above and one joint below is directly affected because of the hip joint. So now let's understand how to keep our pelvis in terms of the hip joint. Okay, so I'm going to turn towards the side and I'm going to show you there are two movements at the pelvis. Okay, one is the anterior pelvic tilt, okay, wherein you can see that the back is arching, the hips are out, and the abdomen is a little bit protruded forward. Okay, so that's how your pelvis is facing a little downwards. This is anterior pelvic tilt. Okay, And if I go other way around, okay, now I'm flattening my back, my abdomen is in, the hips are in, okay, and the pelvis is facing a little upwards. Okay, so that is a posterior pelvic tilt. Okay, so once again, anterior pelvic tilt and posterior pelvic tilt. Okay, so either of these positions are not the resting positions of the body. You are not supposed to be naturally in anterior pelvic tilt all the time. You're not supposed to be naturally in posterior pelvic tilt all the time. You have to find a mid position between the two. So neither too much anterior pelvic tilt, neither too much posterior pelvic tilt. You have to find a midpoint between the two. That is the right position of the pelvis. Okay, whether it is in standing or sitting. Okay, neither too much anterior pelvic tilt. Can you see how my body position is actually altering? If I am constantly in anterior pelvic tilt, one is my lumbar spine will be predisposed to pain. Another, my knee joints are going to be predisposed to pain. So it is very important that I neither be in this, nor if I am in this position. Okay, so then what will happen is, again, my lumbar spine will be prone to pain. The hip joints will also be prone to pain along with the knee joints. So again, anterior pelvic tilt, posterior pelvic tilt, and come back to the neutral position. That is a midway between the anterior and posterior pelvic tilt. So how you're going to do this is, imagine your pelvis is a bowl filled with water. Okay. So if you are pointing the bowl forwards, the water will spill from the front. Okay. If you're pointing the bowl backwards, the water will spill from the back. So the bowl has to be straight so that the water doesn't spill from the front nor from the back. Okay, so it has to be straight. I hope you can understand this mechanics. Okay, how we are working on the correct starting position of the pelvis, so that neither the lower lumbar spine is affected nor the hips are affected. Okay, so let's do it together. Once, just put your pelvis in anterior pelvic tilt. Okay, try to put your pelvis in posterior pelvic tilt. Now find a midpoint between the two. So you're neither too anterior nor too posterior. Okay, so neither too much front nor too much back. So this is how you can practice finding the neutral position. Initially, it may be a little difficult. You can take the help of a mirror to see how you're tilting your pelvis front and back and find the neutral position. So mirror is a good biofeedback for you. Okay, it's going to help you a lot with this kind of thing. So mirror can help. So you can just stand in front of the mirror and you can see yourself performing this tilts and finding the neutral position. Another thing, you will find that in either of the positions, you won't feel as tall as you find yourself in the neutral position. So in the neutral pelvis position, you'll find yourself really tall. But either if you are in the anterior pelvic tilt or you are in the posterior pelvic tilt, you'll find that your height is reducing slightly. So you can try to, figure out what is the neutral position of the pelvis. Because if I give you an example, whenever we are doing any asana, if you're already in anterior pelvic tilt and you're doing that particular asana like that, it's going to strain your lumbar spine a lot. So you need to find what is the correct pelvis position and then perform the asana. So this is the first and foremost thing, is to find the neutral pelvic position in standing as well as sitting. Okay, so that we are going to do first. Now the next part of the session comprises of the asanas and the awareness with which we are supposed to do the asanas. So I'm going to categorize the asanas into two parts. One is weight bearing asanas and another is non-weight bearing asanas. Okay, so you can use your hip in weight bearing position where the body weight is coming on the hip. Okay, and you can use the hip in non-weight bearing position where you are actually lifting the hip, against gravity. So this is a non-weight bearing position for this hip. Okay, so I'm just lifting my hip and putting it into different positions. Okay, so we are going to go through those asanas and we are going to see how it is going to affect our hip joint. So let's get into it. First and foremost, starting with conditioning, of course, as we always do. Okay, so let's start with Sthit Prathanasana. Okay, so before we go into Sthit Prathanasana, uh, good morning Asha ji, good morning Jagdeep ji, Namaste Diksha ji, good morning Lakshmanan ji, Sarosh ji, I have spondyloarthrosis, was under control. Few days ago, while attending a yoga session, my mat slipped and I had a fall, hurt my hips and lower back. Okay. Any stretches I can do now and while traveling? Uh, Sir, I would recommend if you had a fall, okay, it's always recommended to rest more than do any kind of stretches right now. Okay. And if the pain is really acute, it is better to do icing, okay, that will help in reducing the pain. So first and foremost is doing this, and second is if the fall was really impactful, you need to visit a professional and get yourself assessed for any kind of injuries. Okay, so you need to visit an orthopedician and get yourself assessed if there is any internal injury. Okay, only then you should start any exercises or stretches. All right, so now let's start with conditioning practice first. Okay, so keep your feet together. We will start with Sthit Prathanasana. Keep your back straight. Weight is distributed equally on both the hips. Try to find a neutral position of your pelvis. Not too much anterior, not too much posterior, a neutral position of your pelvis. Look at a point in front of you. Chin parallel to the ground. And now slowly join your hands in front of your chest or your sternum. Close your eyes. And just focus on your body and your breath. If you feel that you cannot maintain the balance with your eyes closed, you can keep your eyes open and focused at one point. You can also keep a little bit of distance between your feet if balancing is difficult, but try to maintain the correct position of the body as much as possible. And focus on your breathing and your body. Get all the awareness of your body. Try to understand the different joints of your body, the muscles, how are they feeling? Slowly, you can relax and release and open your eyes. Okay, let's start with the warm up as we always do. So, first is starting with the neck. Keep 1 foot distance between your feet and take your neck up and down. One, two, three, four, five, six, seven. Now turn your head towards either sides. One, 2, 3, 4, 5, 6, 7. Now drop your ear to the shoulder. 1, 2, 3, 4, 5, 6, 7. Slowly keep your hands on your shoulders and turn your shoulders. 1, 2, as much as possible, bigger circles. 3, 4, 5, 6, 7. Okay, the other way around. 1, 2, 3, 4, 5, 6, 7. Perfect. Okay, now slowly take your wrist in front, make a fist of your hand and rotate your wrist. 1, 2, 3, 4, 5, complete circles. 6, 7. Other way around. 1, 2, 3, 4, 5, 6, 7. Perfect. And relax. Now slowly interlock your hands in front of you and try to turn your body towards either sides. 1, 2, 3, 4, 5, 6, and 7. All right. Now slowly we are going to move to the hips. So keep a little more distance between your feet. Okay. We are going to shift the weight of our body towards one hip and then shift it towards the other. Okay. So shift it towards one hip and shift it towards the other. 2. Shift. 3. Shift. 4. Shift. 5. Shift. 6. Shift. 7. Okay, this habit of standing on one leg all the time, this is a very common habit and can lead to multiple problems in the hip, lumbar, spine, knee. Okay, so it's very, very important. It's okay to stand on one leg, but you keep shifting the weight on the other leg as well. And at times in between, you should also weight bear on both the legs. So it's very important that you do not have a habit of standing all the time on one leg only and in one way only. Okay, that's not right. You need to shift weight on both the legs. All right, next let's go on to the knee. So we are going to just bend the knee 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. On the other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, now slowly rotate your ankle. 1, you can take support of the wall if you feel you cannot maintain the balance. 2, 3, 4, 5, 6, 7. Okay, do it on the other side. 1, 2, 3, 4, 5, 6, 7. All right, so we are ready for the asanas. We are going to start with the first asana that is called as Ekpadasana. If you have arthritis of the knee joints or you have had any injury in the lower limbs, if you have had any kind of issue of vertigo, okay, or hypertension and cardiac disease, please do not do this asana, okay. Now we are going to progress with the Ekpadasana. Over here, what we are doing is we are going to put the hip into a non-weight bearing position and one hip is in the weight bearing position. So how do you do Ekpadasana is you lift the leg up and keep it as high as possible on the inner thigh. Okay, focus at one point in front of you and join your hands in front of your sternum. Stay there. 1, 2, 3, 4, 5, 6, and slowly relax and release. You can initially also take the support of a chair or the wall. That is absolutely okay. You need to figure out how is your balance and work accordingly. Okay, so go slow and steady, be patient with your body and train it to get a better balance each day. Okay, another leg, hold. 1, 2, 3, 4, 5, 6, and slowly relax and release. Okay, it's very important that if at all you're not able to take the leg as high as possible, you do not keep the foot directly at the knee. Okay, because that's going to create a lot of strain at the knee joint. So it's important that you either keep it below the knee or you keep it above. Okay, but not directly at the knee joint. Okay, that is one thing. Another thing is that you have to keep your hip absolutely straight. Okay, do not try to lean on your hip like that, because as you keep the leg on the inner thigh, you may have tendency to push the hip out on that side. Do not lean onto your hip on that side, but keep your hip as straight as possible. Okay, so keep it straight and now slowly stay there. 1, 2, 3, 4, 5, 6, and slowly relax and release. Okay, the other side, we're going to repeat it. Okay, keep your leg on the inner thigh. Stay there. 1, 2, 3, 4, 5, 6. Slowly relax and release. Okay, one more time, last time. Keep your leg on the inner thigh. Stay there. 1, 2, 3, 4, 5, 6. Slowly relax and release. The other side. 1, 2, 3, 4, 5, 6. Slowly relax and release. Okay, so your gaze becomes very, very important whenever you're doing any balancing asana. Okay, so your gaze has to be fixed at one point. So this was about Ekpadasana. Now let's go into another non-weight bearing position of the hip. So one hip is in weight bearing, wherein you're keeping the weight on the hip, and the other one is doing a straight leg raise. Okay, so you keep your hands on your waist and you lift your leg up as much as possible. Stay there. 1, 2, 3, 4, 5, 6, and slowly down. Okay, on the other side. 1, 2, 3, 4, 5, 6, and down. Okay, now over here, very, very important. I have seen many times people do this movement. They tend to lean behind or turn their backs, which is not right. Okay, so you need to keep your back straight. You need to keep your pelvis in neutral, and then you have to try and raise your leg up and hold. 1, 2, 3, 4, 5, 6. You may feel a little bit of stress on the front of your thigh, which is absolutely okay. All right, slowly lift the other leg up. 1, 2, 3, 4, 5, 6, and down. One last time. 1, 2, 3, 4, 5, 6. Down. The other leg. 1, 2, 3, 4, 5, 6, and down. So this was a simple straight leg raise exercise, very effective for strengthening the legs and to develop a coordination between the two legs. Okay, so it's a very good exercise to do. Next, we are going to go for another asana, which is a weight bearing asana. Okay, that is called as Veerbhadrasana 2. Okay, so what we are going to do is we are going to take a 3.5 foot distance between the 2 feet. Turn 1 foot outside. Take our hands to the shoulder. Slowly. Bend your hip and your knee. And look at your right hand. And stay there. 1, 2, 3, 4, 5, 6. Come back to the neutral. Turn your leg in. Now turn your left foot out. And slowly bend your hip and knee. Keep your back straight, pelvis neutral. Turn your head towards the left side. Look at your left middle finger. Stay there. 1, 2, 3, 4, 5, 6. And slowly come back and relax. Okay, so here we are weight bearing on the hip joint, and that's how we are strengthening it. Okay, so this is a weight bearing kind of asana. Again, turning the foot out. Take your hands up. Inhale. Exhaling. Go towards one side. Stay there. 1, 2, 3, 4, 5, 6. And slowly come back. And on the other side, turn your left foot out. Go down. Stay there. 1, 2, 3, 4, 5, 6. Inhale and exhaling. Hands down. All right. Now, over here is very important. When you're going into the position, you're not turning your body towards that hip. Neither are you leaning towards that hip. So you're not turning, you're not leaning. You are going to be straight and facing forward from your torso. Okay. So your pelvis is aligned. Only your hip is turning out and bending. So it's over here that we are bending. Okay. Not here. Not over here, but at the hip joint. Okay. So let's do it once again with better understanding and awareness. Turn your right foot out. Take your hands to the shoulder. Inhale. Exhale. 1, 2, 3. Normal breathing. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Turn the other foot out. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Okay. So this was kind of, the initial range of hip movement. Okay. Now we are going to go for a deeper range of hip movement that is nothing but similar to a sumo squat. Okay. So again, taking about a 3.5 foot distance between our feet. Here we are weight bearing on both the hips. You're going to keep your feet almost 45 degrees outside, both your feet turned outside. Keep your hands on your waist. Okay. Again, get your pelvis to the neutral position. Okay. Neither too much forward tilted, not too much backward tilted, but in a neutral position. And now slowly bend both your knees and squat with your back straight. 1, 2, 3, 4, 5, 6. And slowly come back up. Okay, I'm going to show you from the side so that you understand the back position a little better. Slowly squat. Now, do not, if you are leaning forward like this, try to squat a little less and first correct your back position. Okay, try to squat a little less, that's okay. But do not squat too much and lean forward like that. Okay, so let's do it again. Inhale, exhale, 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. All right. So this was about sumo squat. We'll repeat it once again. Last time, 45 degrees outside. Inhale. Exhaling. Go down. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Come back. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Okay, so this was the initial range of squat. Now we are going to do a deeper squat. Okay, so please do it only if it is possible, if you have the mobility and there is no injury at the hip, injury or surgery at the hip or the knee. That is called as malasana. Again, a very effective pose, especially for the reproductive health, for your pelvic health, okay, and for your hip joint, knee joint, and ankle. Okay, so a very effective asana, malasana. So that is, you're going to keep a distance of about 1.5 to 2 foot. Okay, so I'm taking a 1.5 foot distance. Turn your feet 45 degrees outside. Join your hands at the sternum. Inhale and exhaling, squat fully. And slowly, you can touch your elbows to your knees or the thighs and push them outside and be in that position. 1, 2, 3, 4, 5, 6. And slowly up and relax. Okay, so we are going to see this once again. 45 degrees outside, not 90 degrees, only 45 degrees outside, 1.5 foot distance. Join your hands at the sternum. Slowly bend down. 1, 2, 3. Push your knees outside and stay there. 1, 2, 3, 4, 5, 6. Slowly push yourself up and relax. Sometimes some people may not have adequate strength to push themselves up. You need to train yourself with the help of a wall or a chair to first start lifting using your hip muscles. Okay, so that is your inner thigh, your glutes, your hamstrings. Okay, so start using your hip and thigh muscles to get up. Okay, you're not supposed to use your back muscles more, but your hip and thigh muscles. So let's do it once again. Join your hands at the sternum. Bend down. Push your knees outside. Stay there. 1, 2, 3, 4, 5, 6. And slowly come up. 1, 2, 3. And relax. So this was malasana, again a weight bearing asana, and we are going into a deeper range of hip movement. Okay, so this was about malasana. So these are a few weight bearing and non-weight bearing exercises and asanas that I wanted to tell you for the hip joint. Okay, now let's go on to certain sitting and maybe you can say a low lunge or half, weight bearing in a low lunge position. So it's kind of a midway between sitting and standing. So let's go on to the next, wherein we are going to sit in Virasana. Okay, so like this. So this asana we are going to do, that is called as Anjaneya asana. It's a low lunge position. So again, a little bit challenging asana. If you are facing severe arthritis, recent surgery, injury to any of your lower limb joints, you're not supposed to do this asana. Okay, so let's go on to Anjaneya, but a very powerful asana for the hip joint strength. So it's going to actually strengthen your hip joint a lot. It will also stretch a few muscles which are related to the hip. Okay, so let's see how to do it. You keep your hands down, keep one foot forward. Now slowly weight bear on the leg, stretch your other leg behind and lift your hands up and lean behind. Stay there. 1, 2, 3, 4, 5, 6. Slowly bend your knee, keep it down, release your grip, and come back to Virasana. Okay, so a very powerful, it needs a good strength of the hip and knee. Okay, let's do it again on the other side. Keep one leg forward. Slowly stretch your back leg. Take the weight on the front leg. Take your hands up and lean behind. Stay there. 1, 2, 3, 4, 5, 6. Knee down. Release your hand and release your leg. Okay, a very powerful asana. It's going to also help in weight management because it increases the metabolism and it strengthens the hip like anything. Okay, let's do it once again. One leg forward, weight bear. Stay there. 1, 2, 3, 4, 5, 6. Slowly. Knee down, relax. And on the other side, stretch your leg behind, weight bear. Take your hands up, lean behind. 1, 2, 3, 4, 5, 6. Relax and release. Wherever you feel you're not understanding the breathing pattern, you can always breathe normal. That's a good way to deal with it. All right, now let's see with the breathing pattern. So first in Virasana, step forward, stretch your leg behind, weight bear, and 1, 2, 3, 4, 5, 6. Exhale, 1, 2, 3. I'm going to repeat on the other side. Inhale, 1, 2, 3. Stay there, normal breathing. 1, 2, 3, 4, 5, 6. Exhale, 1, 2, 3. So this was a low lunge position, a strengthening exercise for the hip, as well as it stretches the muscles of the hip, which was behind. Okay, so it promotes hip extension. Now we are going to do Kapotasana. Again, a hip opening asana. I'm going to show you how you can achieve the same stretch in a little bit easier way or a non-weight bearing position. Okay, so first let's see Kapotasana. Here, we're going to keep the leg forward like this. Stretch the other leg behind. Try to get your pelvis down towards the floor. Keep your hands by the side and slowly stretch yourself up. Stay there. 1, 2, 3, 4, 5, 6. Slowly relax and release. We're going to do the same thing on the other side. Okay, so get your leg forward towards the ground. Stretch your other leg behind. Keep your hands by the side. And now slowly stretch your torso or upper body up. Stay there. 1, 2, 3, 4, 5, 6. Slowly relax and release. If this is a little difficult, no problem. We have an easier way to do it. Okay, but first let's see this once again. Here the stretch should be at the hip and not at the knee. If you're feeling the stretch is more located towards the knee, that means you are stressing the knee a lot. You have to slowly try and focus on stretching your hip and not your knee. All right? So let's go. Turn your leg outside. Stretch your other leg behind. Now, getting your pelvis down towards the ground and slowly stretching yourself up. Stay there. 1, 2, 3, 4, 5, 6. Slowly relax and release. Do it on the other side. Turn your leg outside. Get your pelvis towards the ground. Straighten yourself up and feel the stretch in this area. Okay? And stay there. 1, 2, 3, 4, 5, 6. And slowly relax and release. Okay, so this was about Kapotasana, where we are trying to achieve a little bit of mobility at the hip by weight bearing our body weight on the hip joint. Okay, so that's how we are achieving the mobility of the hip. But you can do this same mobility without weight bearing of your putting your body weight on the hip joint also. Okay, so how to do that? You can sit in Sukhasana position. Now, slowly, you can simply raise your leg up, cradle it under with your hand, cradle your knee with the hand, and try to get it towards the chest. Stay there like that. 1, 2, 3, 4, 5, 6. Again, the stretch is going to be somewhere over here. The same stretch that we were getting in Kapotasana, we are going to get it over here as well. Okay, but this is not by not putting the body weight, instead getting your hip towards you. Okay, let's repeat it on the other side. You're going to cradle your hip carefully and slowly get it towards your chest and stay there. 1, 2, 3, 4, 5, 6, and slowly relax and release. Okay, let's repeat this again, but I'm going to show you something from the side. Okay, so when I'm lifting the hip up and cradling it, can you see my back? Okay, it's absolutely straight. I am not doing this. This is not correct when you do this kind of asana. You're supposed to have your pelvis fixed. Only when your pelvis is fixed, you will be able to get the stretch at the hip. Okay, so like that and stay there. 1, 2, 3, 4, 5, 6, and slowly relax and release. Okay, on the other side, cradle your hip and stay there. 1, back straight. 2, 3, 4, 5, 6, and slowly relax and release. So this was about the same stretch. Okay, it's also called a Padmasana stretch variation. Okay, so which is going to help you get your hips mobile but without putting any body weight on it. So an easier version of the same stretch. Okay, now let's go on to another asana, very commonly used, that is the Bhadrasana or butterfly stretch. Okay, which most of you must be doing on a regular basis. So you keep yourself in Dandasana position, sit straight, and now slowly turn your feet inside, get your soles together, and get them as close to the body as possible. Interlock your hands, grab your toes, and slowly straighten your back as much as possible and push your knees down. Stay there. 1, 2, 3, 4, 5, 6, and slowly relax and come back to Dandasana position. Okay, why am I asking you to straighten your back again? Because it is linked to whether you are moving the hip or you're moving the back. So if you're doing the Bhadrasana with the back like this, okay, you're also mobilizing the back too much. that can lead to back pain eventually. So that's why your aim is to push your knees down, but to push your back up. Stabilize your pelvis and try to get mobility at the hip. Stay there. 1, 2, 3, 4, 5, 6. And slowly relax and release. Okay, let's repeat it one last time. Sit in Dandasana first. Now slowly get your soles together. Get it closer to the body. Interlock your hands. Straighten your back and stay there. 1, 2, 3, 4, 5, 6. Slowly relax and release. Okay, so that is Bhadrasana. Now, one of the very simple asanas which we feel how much, I don't know how much it will be effective, but it's a very effective pose. It is simply sitting in Dandasana. Okay, so this straight position and keeping your back straight, sitting on your sit bones, okay, especially those who are doing desk work, okay, desk jobs, they can do this pose and it's going to be very effective for their postures. Okay, so what you have to do, keep your hands on your thighs and try to straighten your back as much as possible in this position. Keep your knees straight, keep your feet together, okay, and sit in this position. 1, 2, 3, 4, 5, 6, and slowly relax and release. Okay, it's going to activate your hip flexor muscles over here because you're trying to keep your back straight. It's going to activate your core. It's going to activate your back muscles to keep you erect. Okay, and it's also going to stretch your hamstrings. So it's doing multiple works all together. Okay, so let's do it once again. Sit on your sit bones proper, lift your hips and try to sit on your sit bones. And now slowly, knees straight, back straight, and make yourself as erect as possible. Stay there. 1, 2, 3, 4, 5, 6. And slowly relax and release. Okay, so this was Dandasana, a very effective position for improving your posture and your hip strength as well. Okay, now we are going to go for some lying down poses, which are again going to help in opening of the hip as well as creating some strength and mobility. So I'm going to give you a mixture of exercises and asanas which are going to help with the same. All right, so let's get into the lying position. But before that, let me answer a few questions. Renuji, knees have been operated. Can I do this asana? So Renuji, I think I need to understand what kind of surgery you have gone through to be able to tell you anything about, which asana you could do or which you couldn't. Plus, we also need to know how is your muscle strength in order to be able to tell you whether you can do the standing asanas or lying down asanas are better for you. Okay. Jagdeep ji says, which is the best asana to reduce the feeling of laziness? So I think Jagdeep ji, initially there is a lot of inertia and resistance in our body to, to get set moving. But once you make it a little bit of a habit to get onto the mat every day at a particular time, okay, slowly and steadily that inertia gets overcome. Plus, whenever you are practicing, this is my personal experience, if you totally focus on your body and try to develop your practice and you start seeing the results of your practice, you automatically become motivated to continue the practice, and that inertia which is coming from inside is slowly overcome. So we need to get onto the mat every day at a particular time and start practicing with that awareness to, to overcome that feeling. This is my personal experience, which I am sharing with you. All right. So now let's get into some lying down poses. Okay. So we are going to lie down on our side as always and then turn on our back. Okay, so the first exercise is a simple straight leg raise, okay, which can be done with most of you, by most of you. You need to bend one knee and you need to simply raise your leg up to 90 degrees. Hold one with your knee straight, ankle neutral. 1, 2, 3, 4, 5, 6, and slowly take it down. Okay. Same thing on the other side. Bend your opposite knee and lift your leg up. Knee straight, ankle neutral. 1, 2, 3, 4, 5, 6, and slowly down. Okay, again, lift your leg up, stay there. 1, 2, 3, 4, 5, 6, and slowly down. On the other side, lift up. 1, 2, 3, 4, 5, 6, and down. If you want to challenge your thigh muscles, you can always incline the leg at a particular angle instead of taking it full to 90-degree and stay there. 1, 2, 3, 4, 5, 6, and down. But make sure that when you are doing, the stress is not entirely on the knees. If the stress is on the knees, that means you're not taking adequate load on the thighs. Okay, so lift. 1, 2, 3, 4, 5, 6, and down. So this was a simple straight leg raise exercise. Now we are going to do something that is Supta Bhadrasana. Okay, so we're going to join the soles together and slowly drop our knees apart. You can keep your hands on the inner thighs and stay in this position. 1, breathe normal. 2, 3, 4, 5, 6, slowly. Get your knees together and straighten your legs. We will repeat this once again. Soles of your feet together. Drop your knees away from each other towards the ground. Keep your hands on the inner thighs. Breathe normal. 1, 2, 3, 4, 5, 6. Get your knees together and slowly straighten your legs. Once again, bend your knees, soles of the feet together, and drop your knees outside. Stay there. 1, 2, 3, 4, 5, 6. Slowly relax and release. Okay, next we are going to go for Supta Vakrasana. Okay, 4. So Supta Vakrasana 4. Here we are going to bend our knees, keep some distance between our feet. Okay, and now what we're going to do, keep our hands at 90 degrees. Drop our knees in such a way that right now I'm dropping the knees towards the right side. So my right foot is in contact with the left knee. Okay, that's how I'm dropping the knees. And turn the head towards the opposite side. Stay there. 1, 2, 3, 4, 5, 6. Straighten and do the same thing on the other side. So now your right knee is in contact with the left foot. Okay, and turn your head towards the opposite side. 1, 2, 3, 4, 5, 6, and slowly back. Okay, on the other side, once again. 1, 2, 3, 4, 5, 6, and slowly back. Again. Other side. 1, 2, 3, 4, 5, 6, and slowly back. So this was Supta Vakrasana 4, a good mobility for the hip. Okay, now we are going to go onto a side lie. So we're going to lie down on a side, and I'm going to show you one exercise, that is the hip clamshell exercise. So you need to bend your hip and knee. Okay, your ankle, hip, shoulder, and head is in one line, and your knee is a little forward. Now, without turning your back, you need to lift your knee outside as much as possible and stay there. 1, 2, 3, 4, 5, and down. Okay, so now as you're not turning the back, you're using your hip muscles to turn your knee out. Stay there. 1, 2, 3, 4, 5, and down. Once again. 1, 2, 3, 4, 5, and down. Okay, you can do the same thing on the other side as well. So I'm going to turn myself to the other side and show it to you. Okay, same thing, same position. Keep your hand on the waist so that you do not turn your back and just turn your knee out. 1, 2, 3, 4, 5, and down. Once again. 1, 2, 3, 4, 5, and down. Last time. 1, 2, 3, 4, 5, and down. All right. Now, the next thing is going on to the abdomen and doing Shalabhasan. Okay. So keep your chin down on the ground. Keep your hands by the side. Point your toes down. Lift your leg up and hold. 1, 2, 3, 4, 5, 6. Down. 1, 2, 3, 4, 5, 6. Down. Once again, lift. 1, 2, 3, 4, 5, 6. Down. 1, 2, 3, 4, 5, 6. Down. Okay, so this was about hip extension. Now let's relax for a minute in Supta Bhadrasan again. Okay, so we're going to maintain the Supta Bhadrasan position and just close our eyes and relax into that position. Just breathe normal. And just try to leave your body loose as much as possible. Slowly get your knees together and straighten your legs. Now you can turn on one side and get up. All right, so this was some of the poses which are going to help your hip joints. It's going to strengthen, provide mobility, and as much as possible, do it with a lot of awareness whenever you are doing it. So some tips that I have given you for the awareness, you can follow them. Okay, that is going to help you build that kind of knowledge about your body, and it's going to help you improve your body immensely. All right, before going on to the task of the week, let me answer a few questions. So Jagdeep ji, if you do that already, probably you can look into some other factors, maybe nutrition, hydration, sleep. How are all these factors? Maybe that is contributing to the feeling of laziness. Okay, you can look into those and try to correct them as well. Okay, maybe that can help you overcome that feeling. All right, Lakshmananji, does doing neck rotation bring vertigo problem? Yes, neck rotation can cause a vertigo if you already have that problem. Okay, so it's better not to do a neck rotation when you have a vertigo problem. All right, so you need to get that fixed first, the problem of vertigo, and only then go ahead with safe movements of the neck. All right, So a neck full circumduction of the neck can actually aggravate vertigo. Minor issues with knees and ligaments, initial stage. Shall we do all asanas, what you have done today? If not, which one to be avoided? Okay, so what are, I need to understand more about what is the initial stage, whether you have suffered an injury with the ligament or is it a simple degenerative change of the ligament? What exactly is happening? Only then I can suggest, what asanas you can be doing. However, the lying down poses that we did are a few simple, like the straight leg raise, the clamshells that we did. If you do it properly, it's going to help you with, strengthening your hips and legs. All right. So now the task for the week for you today is to practice Supta Bhadrasan for 30 seconds daily. Okay. You can click a picture of yourself doing Supta Bhadrasan and upload it on Instagram, tag Times Health Plus. Also, do follow Times Health Plus on their Instagram and YouTube channels to get more and tips and recommendations related to the same. All right, so now this was it for today. You can always journal your feelings. How are you feeling each day after doing yoga? That's going to help you understand what track are you going into. What is the feeling that you're having in the body? So journaling is a very good way to keep yourself motivated. I hope I have added on to your knowledge about the different joints that we are going through. Stay tuned for some more joints and the tips and recommendations related to the same. I'll see you next time. Till then, stay present, move gently, and make sure you take care of yourself. Thank you and namaste.